There was a polio epidemic in Buenos Aires in 1957, and Dr. Francisco Aiziaga studied the symptoms, and he felt that it resembled those of a homeopathic remedy, Lathyrus sativa. Homeopathic doctors and pharmacies prescribed Lathyrus as a prophylactic, and thousands of doses were administered. Nobody registered a case of polio. And if you compare that data to the United States, where it was a major epidemic and no homeoprophylaxis was used. So why are allopathic or traditional doctors against homeopathy? One physician in a Pittsburgh hospital asked a nurse if she knew anything better than what he was doing because he was losing so many cases. Yes, doctor. Stop aspirin and go down to a homeopathic pharmacy and get homeopathic remedies. The doctor replied, but that is homeopathy. I know, but the homeopathic doctors for whom I have nursed have not lost a single case. So what can we do? How can homeopathy help us right now? There's two methods we can look at. One is homeoprophylaxis, and the other is actual homeopathic treatment. Homeoprophylaxis is the systematic use of homeopathic potentized substance to prevent the development of the characteristic symptoms of the infectious disease. It was first utilized by Samuel Hahnemann in the 17th century. Dr. Isaac Golden, in his book, Homeoprophylaxis, a 15-year clinical study, reports the effectiveness of homeoprophylaxis at around 90%. Now, there's different ways we can do homeoprophylaxis. One is the influenzinum nosode, oscillococcinum, and the genus epidemicus. These can be used prophylactically before the prodrome or the symptoms even begin. Once the actual illness begins, it is better to await definite symptoms and then select the proper homeopathic remedy. Though the influenzinum nosode and the Homeopathic Pharmacopoeia Convention of the United States defines a nosode as a homeopathic attenuation of a pathological organ or tissue, causative agents such as bacteria, fungi, ova, parasites, etc. So this is made from tissue actually infected by the influenzinum virus. Oscillococcinium is made from duck liver and heart, Anis barbari, hepatis, et cordis extractum. This homeopathic product is now widely used in more than 50 countries, and in France it has been in production for over 65 years. One study showed 63% of patients with complete resolution or clear improvement at 48 hours. The good news of this study was evaluated in a double-blind, placebo-controlled clinical trial published in the British Journal of Homeopathy. Now, the genus epidemicus is something else we look at. These are characteristic symptoms that are collected from patients who suffer from the flu. Then specific homeopathic remedies are matched based on these symptoms, based on the law of similars. These remedies then become a specific homeoprophylaxis for the flu. And in Hahnemann's time, every major epidemic was treated that way. The homeopaths would collect their data and try to decide what homeopathic remedy has the best fit for the disease. And so immediately when a patient came down with symptoms, they were administered these remedies based on their symptoms, and in many cases it just aborted the flu and helped save their life. When you select a homeopathic remedy, you need to evaluate particular physical symptoms in each patient. You need to look at modalities, what makes the symptoms and the patient better or worse. Hot, cold, morning, eating certain foods, time of the day, etc. We also need to look at the mental and emotional state, anxiety, depression, anger, fatigue, etc. And also general symptoms. So homeopathy is specific because most people will respond to the flu in a characteristic manner, but there will always be individual variations. Some people may be more anxious, some people may have more diarrhea, some people may have more cough. And we take those particular manifestations to select the right remedy. So I went online and found out what homeopaths across the world are considering for the genus epidemicus, for the swine flu, and I'd like to talk to you about those particular remedies. In the meantime, you can look at the two that I mentioned, the influenzinum, nosode, and also oscillococcinum. And both of those I'll give you telephone numbers and web addresses for places you can order them. Aconite. Aconite has always been a major key remedy in the treatment of flu. And the characteristic features are runny nose and watery eyes, mild flu symptoms, but they tend to be very, very anxious. And certainly we have a lot of anxiety about the swine flu, and many people who begin to get some sniffles, runny eyes, and flu symptoms, they begin to panic. Oh my God, I got the swine flu, I'm going to die. And that's a characteristic symptom of aconite. Baptisia. This is the flu patient who is very listless and prostrated. They're fatigued, they have no energy, they're indifferent, they have very, very offensive diarrhea. Another characteristic feature of this is that their body feels very sore and bruised. They can't get comfortable in bed. The bed feels too hard. They're complaining about any surface that touches their body. Arsenicum album is another big flu remedy. These patients are very restless, anxious, and fearful. They're very thirsty, but they drink small quantities and often. They're prostrated. They have diarrhea after eating or drinking anything. Nausea on seeing or smelling food, and they have burning pains. These are characteristic features of arsenicum. Ipecac is another big homeopathic remedy, and it has the characteristic of having a lot of nausea, intense nausea and pain in the bones. The last one is Eupatorium perforatum, and these patients don't have much in the way of gastrointestinal symptoms, but they have very deep pains in their bones, with severe aching in their bones, which is characteristic. Taking a homeopathic remedy. Take several pellets and let them dissolve in your mouth, or what I like is you put several pellets in a glass of water and just sip the solution slowly over the day. You can take it 3 times a day. Stop once there is a marked improvement. Homeopathy differs than traditional medicine. When you're told to take an antibiotic, you got to take it for 2 weeks. If you miss a day, it'll come back. In homeopathy, it's acting as a catalyst to give your body strength to heal itself. Once the body absorbs the remedy and begins that healing process, you don't need it anymore. If there's no improvement after taking a homeopathic remedy after 12 hours, most likely the remedy is incorrect. So review your symptoms or your patient's symptoms and then select another homeopathic remedy. These are a list of homeopathic pharmacies that I deal with, and I'll give you my email address. So those of you that would like a copy of this presentation, I could email it to you, because I don't know if anyone here could actually copy the talk and pass it out. This is an excellent book, The Homeopathic Treatment of Influenza, Surviving Influenza Epidemics and Pandemics, Past, Present, and Future with Homeopathy. And this goes into detail reviewing all of the major epidemics that I talked about in detail and how homeopathy helped people.